Aloha, I'm Dr. Irene Papakonstantopoulos, a pediatrician with Champs Pediatrics in Kihei, Maui. Vomiting and diarrhea are very common in children. Together, they are sometimes called gastroenteritis by your doctor and stomach flu by others. The biggest concern with vomiting and diarrhea in infants and children is the risk of dehydration. It's fine if your child doesn't want to eat solids for a couple of days, but he or she really needs to keep drinking fluids. Some symptoms of dehydration include thirst and a slightly dry mouth, decreased urination more than 6 to 8 hours between wet diapers or urine output, no tears when crying, eyes that appear to be sunken, and an anterior fontanelle, the soft spot in babies, sunken in. The trick behind oral rehydration is to give your child very small amounts of fluid very frequently. This small amount is absorbed without causing additional nausea. You can almost always avoid a trip to the emergency room using this method. Give your child small sips or 1 to 3 teaspoons, about 5 to 15 milliliters of Pedialyte, breast milk, or water for infants older than 6 months every 5 minutes in a little syringe or small cup. If you give your child a full cup of fluid and tell her to sip, she will probably drink too much too fast. Occasionally, we do prescribe medication like ondansetron to older children to stop the vomiting in order to prevent an admission to the hospital. Any medication, though, should only be taken in coordination with your doctor. Pedialyte or other oral rehydration solutions, popsicles, are a great option since they replace lost sodium or potassium. These also contain the appropriate number of electrolytes to keep children's sugar and salt levels in a normal range. If your child does not like the taste, you can mix it with a small amount of juice. Do not give full-strength juices or drinks with sugar, as these may worsen the diarrhea. If your child vomits, take a break for 30 minutes and start again. Increase to 1 ounce per hour. When your child has not vomited for 8 hours, he or she can slowly return to a regular diet. If you have any questions, you can send them to info@akaku.org and they may be featured in the next segment.